So let's start off in KZN, where 66 people connected to the St Augustine's hospital have tested positive for COVID-19. Now, 48 of them are said to be healthcare workers based at that institution. Our reporter in Durban, Karinda Jacques is on the story for us. She joins us now live from just outside the St Augustine's hospital. Karinda, a very good morning to you. Great to always get your insights. So it's quite an extraordinary set of circumstances, isn't it? Tell us about how these number of cases actually unfolded and what actions will be taken next.
Good morning to you. Yes, indeed. Now, the St Augustine's Hospital now has 66 people connected to the hospital who've been tested positive for the virus. 48 of those are healthcare workers who work here at this private hospital, which is located in the Durban CBD. Now, last week we saw in the early hours of the morning the closure of the trauma unit here, and we saw that patients and staff members were getting swabbed from the early hours of the morning towards the afternoon. This is when the first few tests or positive tests came in of healthcare workers being tested positive for COVID-19. Since then, the hospital has announced via Netcare that they're no longer admitting new patients. The trauma unit is closed, and we understand that the management is in talks with the local government as well as the Department of Health to understand steps going forward. Now, we do know that fumigation of this hospital is expected to take place soon. Today, we understand that meetings will get underway to decide whether or not the hospital or which parts of the hospital should be further closed down going forward to ensure the safety of people here. You must understand now with this number at 66 and more tests being conducted, tracer teams are doing extremely important work to track down those people who have been in direct contact with the patients who've tested positive for COVID-19 here. Now, 3 of KZN's deaths related to COVID-19 stem from this hospital. All people who are elderly in their 80s were admitted to this hospital with symptoms of the flu of COVID-19 and then sadly passed away due to underlying conditions as well that further exacerbated the effects of them regarding the COVID-19 symptoms. Now, we understand that this afternoon there will be a media update by the KZN Premier Sihle Zikalala, where he will announce his decisions on whether or not parts of this hospital will be closed down further and when exactly those efforts to fumigate this hospital will take place. But another concern is that many of the essential workers here do use public transport to come to work. That is another concern in terms of what the tracer teams have to do going forward to ensure that anyone who is in direct contact can be screened as soon as possible to prevent further major transmission of the coronavirus.
Yeah, that's right. That's certainly going to be where a lot of the focus shifts as, of course, we await those details about whether or not the institution will be closed down. I do remember yesterday there were calls, though, for individuals who've been to the hospital to actually come forward for testing and screening and the likes. Do we have an idea of how many people actually did heed that call?
Well, the Department of Health has not revealed the number of people that have come forward. We do understand that as of last week, over 150 tests were done. We know now that 66 of those tests have been positive, with 48 being healthcare workers. Going forward, the department has again emphasized that call that if you were a patient at the St Augustine's Hospital since the beginning of March or have visited and entered the hospital premises and been in direct contact with the people who work here, to come forward, contact the KZN Department of Health or the national hotline to say that this is the situation that you've been in. You can come forward to be screened for any symptoms of COVID-19 and further be tested for the virus. Now, it's extremely important that members of the public do this. This is to ensure that you, of course, mitigate transmission of the virus and to ensure that people who you've been in direct contact with following this can also further be contacted to be screened. All of this, of course, to prevent the COVID-19 virus from further spreading and, of course, ultimately to flatten that curve.